So Devon, let's say that a child is going to have some specific remediation work done with auditory processing disorder. What does that involve?
Well, following the assessment, we would then delineate what are the major difficulties for each child, because they won't necessarily be the same. So we know that one of the biggest problems for many children with auditory processing is the issue of difficulty hearing in background noise. So in addition to maybe wearing an FM system, we now have a specific program to develop the skill of fine-tuning one's perception in background noise.
This is about being able to zero in on particular sounds.
And ignore the background noise.
Right, and that's a skill that can be developed.
Yes, according to the developers of the LISTEN program, that's LISN, you can specifically train that skill of tuning into a speech signal in the presence of background noise.
So who specifically developed the LISTEN program?
The LISTEN program came out of a PhD research of Dr. Sharon Cameron at the National Acoustic Laboratory here in Chatswood in Sydney.
Here in Chatswood? Mm-hmm. Homegrown?
Absolutely.
Very good.
Down the road.
So we're talking then, I guess, zeroing in on sounds, being able to discriminate between the sounds that you then zero in on as well?
Yes, and we have other computer programs that have been specifically designed to do that. Programs like the Fast Forward program and the Aerobics program.
They're computer-based?
These are computer-based.
Right.
Mm-hmm.
Those particular programs are explicitly written for those particular problems, or do they also address other things?
Well, the Fast Forward program there is a series of programs in Fast Forward. They have a vast range of skills that they train, including auditory processing skills, language skills, and cognitive skills, and reading skills.
What about some more traditional methods? Are there practical exercises that students can do? Is it a little bit like going to the gym, but just for your ears, so to speak?
Yes, there are. And if you can't access computer programs, there are many strategies that can be employed to develop aspects of auditory processing, depending on what the child's perceived difficulty is, or the child's assessed difficulty.
Okay, so let's pretend that I'm in that situation and I've got a child who has auditory processing disorder and I live remotely, and getting access to speech-language services is difficult. And I'm not very well serviced by internet services and don't have a lot of computers. There are still manual ways that I can deal with this problem.
I think if the auditory processing is impacting on the reading and spelling, then very explicit teaching of sound letter association and sound sequencing is very beneficial. If the child has difficulty with a skill we call auditory closure, that's when we hear a signal, but bits of it are missing and we've got to fill in those bits. We can actually train that with exercises, for example, that we might do some sentence completion tasks. So we might say, Jack and Jill went up the child has to say, hill. Little Miss Muffet sat on her tuffet. A different exercise is we might say a word but omit some sounds and the child has to fill in those missing bits. So we might say, what is this word? And it might be telescope, which is telescope, or hospital. They've got to tell you it's hospital. So what you're trying to do is the child's using their word knowledge and their context knowledge to fill in those missing bits. So we can train that, and there are various websites that you can access to download games of that nature, and they're called auditory closure exercises.
Okay, so there's some practical examples for auditory closure. Just coming back to what you said before, how could a parent teach something like sound letter association?
Look, I think you do need some materials to assist you with that, because when we want to teach sound letter association, we want to teach it in its correct way. So when we're teaching that, for example, the letter M makes the sound M, we don't want to say the letter M makes the sound M. because mu is actually two sounds. So I think guidelines from programs like Reading Eggs is a very good program, Phonics Alive is a very good program, and these are very easily accessed on the internet, and I believe not very expensive at all. There are other programs. There's a program called Reading Doctor, which is very good, another program called Steps, which is very good, and all these are quite affordable, I think, for most parents.
The way a parent talks to their child, we're suggesting, is a very significant part of their literacy development.
Yes, I think children need very good language models and parents who, you know, need to speak in a very clear way, and keeping their language simple quite often helps these children. We know that auditory processing disorders often impact on language development. So another very simple skill that a parent can help a child develop is vocabulary. Vocabulary is really the core of language, knowing what words mean, the core of reading comprehension, the core of writing. So if parents can encourage their children to learn new words, so you can have a word of the day, let's this week, you know, pick some new words we've never learnt before and learn those. And again, there are many websites, even for children and adults, where you can learn a new word for the day to develop your vocabulary, and they're free. So they're good. I think now with the internet, we have access to many more materials than we ever have had in the past.
And if I was actually able to get access to professional services, is it a once a week thing? Do I have to go and see someone once a week with my child, or is it more intensive than that?
Well, it depends on affordability, I guess. Some programs are only done intensively, and I guess you get more bang for your buck in that way, in that we know that intensive instruction is much more effective in rewiring the brain. So if we can do a program for, say, 8 or 10 weeks on a daily basis, like the Fast Forward program, which is done 50 minutes a day, 5 days a week for 8 to 12 weeks, it very much rewires the brain in those auditory processing areas, and so we get very effective outcomes from a program like that. Or something like the Linda Mood Bell programs, where children do go intensively, work one-on-one with an instructor. Again, they're very effective programs because they're intensive. But not everybody can access, though the beauty of Fast Forward is you can do it at home now on the computer, so it can be accessed pretty much by anyone. But if you need speech pathology, usually people attend once a week, and they'd be given some sort of home exercises to reinforce that therapy.
Something for the parents to work on with the children.
Yes.
Devon, thanks for your time.
My pleasure.